Okay, guys, if we're happy enough, we'll maybe just get started, if that's okay. Cool. So my name is Rosa, and I'm third year at St Andrews here, and I have with me Hamza, who is the main developer at MLABuddy, the app we're going to talk about at the end. So just a quick overview of the sort of things we're going to talk about today. We'll start off by talking about tips and tricks for history taking, so really important things to know for the OSCE. And then we'll look at some common mistakes and how to avoid them. And then we'll move on to talking about AI and introducing MLABuddy. It'll not take too long. It'll be very high yield. So if I ask a quick question, what do you guys find hardest about taking a history? And feel free to turn on your mics and just say it, or you can put it in the chat or whatever works for you. I will go first, and I'll say that I think the hardest part for me is listening and thinking at the same time. So listening to what the patient's saying while also trying to think about what to say next. Sometimes I find that I end up thinking and not listening, or listening and not thinking. So that's something that I had to really work on when I was, especially at the start, especially in first year. So does anyone else want to share? No worries if not, we can come back to it. But again, feel free to put it into the messages. Okay, we'll skip on. So very briefly, an OSCE, which I'm sure you guys all know, stands for Objective Structured Clinical Exam, and it's just a way for the medical school to test our clinical skills, and you get to kind of act like a doctor, dress up like a doctor, and an examiner watches. So, excuse me. In an OSCE, there's kind of three areas that you really want to focus on. You want to think about data gathering, so asking the right questions, finding out the right information that's going to lead you to the right diagnosis. At the same time that you're doing that, you really need to think about building a rapport with the patient because, well, first of all, in real life, building a rapport with the patient is what's going to allow you to make them feel comfortable enough to tell you the important stuff, but also in an OSCE exam kind of situation, you get quite a lot of points for your patient interaction skills and your kind of bedside manner, as they call it at St Andrews. And then finally, you need to think about the management. So less so in first year because quite often they won't ask you what you're going to do next. But when you get into second and third year, they will ask you what you think the next step should be. So do you want to take bloods? Do you want to do any imaging? And you need to be thinking about this as you go through the OSCE. So, as I said, we'll talk a little bit about where people make mistakes. So, a huge one is talking too much, which seems a bit hypocritical for me, as it's just me speaking at the moment. But talking too much and not listening enough is a huge problem, as it means that you are eating up the time that you have to find information out from the patient. So if you're spending 4 minutes, and this kind of links into per time management as well there at the bottom, but if you're spending 4 minutes introducing yourself and asking their name, you haven't got enough time to figure out what they want to tell you. And on that line, forgetting ICE. So I'm not sure if you guys have heard of this acronym before, but ideas, concerns, expectations. What does the patient think is happening? What are their ideas about their own condition? What are their concerns? What are they worried about? Oh, I think I have breast cancer and I'm worried because my mum had breast cancer, things like this. And expectations. What do they want from the consultation? If you have a patient who's convinced that they have bacterial tonsillitis, they're concerned that they can't swallow water, and their expectation is they will be getting antibiotics, that is very important to consider, because if you suggest that they shouldn't have antibiotics, then they can be really upset, and it's another important aspect to think about. Finally, you need to make sure you summarize. So again, in terms of OSCE, rather than real world settings, there's a full mark, at least 2 full marks in every OSCE station for summarizing. So even if you have not a clue what's going on, just summarize, just repeat back exactly what the patient said, and you can pick up at least 2 marks. So it's really really an important one not to forget. And as I said, time management, always really important. Make sure you're thinking about how long you have for each station. For a history taking station at St Andrews, it's usually 10 minutes. So yes. Very briefly, we'll just talk about how to take a history. So the number one thing to do is starting strong by introducing yourself. I always just go for the straight, hello, my name is Rosa. I am a third-year medical student at the University of St Andrews. And then make sure you confirm who the patient is. Can I confirm your name and date of birth, please? Those two sentences are 3 marks. A strong introduction, introducing yourself, confirming the patient details. You've already smashed it at the beginning. Then you need to ask about a presenting complaint and make sure you're always having an open question here. So what brings you in today? Why have you come to the hospital? Would you like to tell me a little bit about why you're here? So that then the patient can lead you through their history, and they often tell you the most important things first, and it's important that you let them. Then moving on, we can dig a bit deeper. The bulk of the history is probably the history of presenting complaints. So you want to ask, when did this begin? How long has it been going on for? Is there anything that makes it worse or better? What causes it? Have you noticed that it happens at night? It happens at morning, in the morning, things like that. In this point, sorry to skip ahead and talk about number 5, but at this point, the patient will often discuss pain. Oh, my shoulder hurts, my leg hurts, my chest hurts. And in this situation, you always want to think about Socrates. So Socrates is an acronym that St Andrews loves. And we talked about it a lot in first year. So it's to do with pain, and it stands for site, onset, character, radiation, associated pain, time, exacerbation, and severity. So if your examiner notices you using even just 2 or 3 aspects of Socrates, this can be really impressive, and it can also really narrow down your diagnosis. So if someone has chest pain, it's important that you talk about the site. Is it on the front of the chest? Is it at the side? Do they feel it at the back? Onset, when did it begin? Et cetera, et cetera. And it can help you narrow down your differential. And then to skip back a little bit, you also want to talk about past medical history, family history, social history, drug history, et cetera, et cetera. This bit can feel like a bit of a tick box, but if you've been building the patient rapport the whole way through, it feels a little bit more natural. And then finally, as we talked about before, you want to summarize. So a nice sentence that I like is, so just to make sure I've got this right, or you could even just say, I now want to summarize to make sure I'm not leaving anything out. And then summarize, and you can also ask about ICE. So do you have any thoughts about what's been causing this? As we have here, the golden rule is, if you don't summarize, did you even listen? So summarizing in real life is a really nice way to prove to the patient that you have been paying attention. If you're able to tell them what they've just told you, it proves that you were paying attention, and that can help with the rapport because it can make them feel more heard. And a huge problem, especially with the NHS today, is patients not feeling heard by their doctors. So make sure you're summarizing so the patient feels as if you actually care and you've actually been listening. Okay, so now we want to talk a little bit about MLABuddy, which is the AI platform that can help you prepare for OSCEs. So I am going to share my screen, if you give me 1 second, and I'll give a little walkthrough of how it works. Guys, if you have any questions at any point, feel free to just ask, especially when I'm popping, just trying to share my screen. Okay. Hamza, can you see that okay? Okay, cool. So this is the website that we have been kind of alluding to. And what it is an interactive AI-based OSCE practice stations. So kind of think Geeky Medics, think Osmosis, think ChatGPT, all in one perfect medicine bundle. So as a quick overview of kind of the interface, you have all of these different stations and scenarios with more being added every day. Today we're going to go through this station here. So when you click on a station, you go in and it gives you a little bit of information, and you can show the walkthrough to tell you if you just want to have a quick walk through what is actually happening. But I'm just going to start the station and give a brief demonstration. I'll not do the whole thing because I don't want to hold you guys. I know you have Anki flashcards to be doing. So in St Andrews, we usually have 10-minute stations. So if we set it for 10 minutes and examiner time 3 minutes, kind of looking at 1 minute per question. So, and then I'll just stop. So it gives a little description on the side. This is what you can think of as like the thing that's pinned to the outside of the curtain in the OSCE station. And so it tells you where you are and what the task is to do. And then the ideal thing with MLABuddy is it's all conversation based. So if I just go straight for, hi there, my name is Rosa. I'm one of the doctors at the emergency department. I understand you've come in with a headache. Could you tell me a bit more about what's been happening? And then just send it.
I have a sudden severe headache. It started about 30 minutes ago while I was watching TV. It's the worst headache of my life.
Okay, I'm really sorry to hear that. When exactly did the pain start, and how quickly did it reach its worst point?
It started about 30 minutes ago and it hit me suddenly and instantly. Like thunderclap, it got really bad right away.
Okay, can you describe the pain? Whereabouts do you feel it in your head?
It's centered at the back of my head and it's throbbing.
Okay, and I'll stop there, but that's a good demonstration of how it actually does feel quite natural with the AI. And once I submit this, obviously I would go further on and take the history, but once I submit this, then the examiner can come and discuss.
Hello, can you summarize your findings from the interaction and explain what red flag symptoms you identified in this patient?
So this patient has come in with a thunderclap headache of about 30 minutes ago. Red flag symptoms I've had is the sudden onset, the description of the worst headache in my life, and the fact that it's the back of the head. And then we can send that.
What are the initial investigations you would consider necessary for this patient presenting with a sudden onset severe headache?
I would like to perform a CT head and a lumbar puncture.
What specific findings from the CT scan and lumbar puncture would confirm your suspicion of a subarachnoid hemorrhage in this patient?
And I'll not go on, but that's a good example of how the examiner can ask you to divulge a little bit more information about the history. And if there's any observations, they'll be shown on the side. So in first and second year, your OSCEs don't have any abnormalities, but in third year, you have pathologies. So for example, they might show unequal pupils or something like that. And for all of the histories, or for some of the histories, they'll be shown on the side here. And it's a really good way to practice your reading of investigations and things for the data OSCE in third year. So I have to submit for a second time, and then it finishes the stage, and then we'll get a little bit of feedback if we wait a second. And it gives you the marking scheme here. So as you can see, did pretty well for only asking 3 questions, but it also tells you what you need to work on. So apparently I didn't build a very good rapport. Maybe next time. And then we can move on, give a bit of feedback. And we're back to the home screen, and we can pick a new topic. So that was a very much whistle-stop tour of the MLABuddy site. So I can stop sharing my screen. Unless, Hamza, is there anything else that I should show on the platform? Cool, so I'll stop sharing. So again, if anybody has any questions, please feel free to ask. And if not, if you guys would, just got 5 more minutes and then we'll pretty much be done. But we just want to discuss a little bit about the usefulness of using AIs to practice for OSCEs. So an important aspect of practicing for OSCEs is the fact that we're not just memorizing scripts, the mini CEXs that St Andrews gives us. It can be really tempting to just memorize step by step by step. But the problem with that is if something goes wrong in your exam, you can get really thrown if you feel like you're not on your steps anymore. So the good thing about MLABuddy is that it's very different scenarios and we can talk to realistic AI patients. As well, you have the fact that scenarios are timed. So this really helps with practicing under time pressure, because I don't know about you guys, but in history taking OSCEs, I always run out of time because I yap when I get nervous and then I forget that I'm timed. So practicing with the time crunch really helps. And then the examiner style Q&A after each station. This is really unique to this platform because it's very, very integrated with like the clinical scenario. And it also means you get a lot of practice with the more real world aspect of things. It's very rare when you become a doctor that you'll take a history and then do nothing about it. So this is where you get to the point where you're integrating your clinical knowledge. And then we also, as we've discussed, lots of new scenarios across different specialties, and also instant feedback. So the little thing we saw with the ticks and X's. I think that is pretty much everything we wanted to talk about, other than if anyone has any questions, please feel free to ask. And if you would like to put your number in the chat, I can create a WhatsApp group to send through a link to access the platform and to practice and give a little bit of feedback if you would be